What's up, everyone? Dr. Tony Crone back for Wellness Wednesday, episode number 35. Today we're talking Osgood-Schlatter Disease. Hope you guys are all enjoying this lovely rainy weather that we had yesterday. We were spoiled and had sunny and 60-degree weather, and now we're back to cold and rainy and possibly some snow. But with Osgood-Schlatter, as we get into the topic, what that is, it's in kids and it's pain at the front of the shin, kind of towards the knee. Okay, so I'll bring my leg up here. It's right under this kneecap, right below it, at what's called the tibial tuberosity. So what happens with it is that due to growing as a kid, our body can't keep up with it. So we have open growth plates until, especially down in our knee where this occurs, until we're in our teenage years. So tightness in the muscle due to lack of muscle development with the increased growing time or sped up growing, it pulls at that insertion, which peels back the layer of the bone. Okay, so we have our quad muscles that blend into our quadriceps tendon, that attaches to the patella. Patella goes into patellar tendon down into that tibial tuberosity where it is. Okay, so tightness in that muscle is pulling at the tibial tuberosity and where that growth plate is, where there's nerve innervation, and so that disrupts or causes that pain that those kiddos feel when they have this type of issue. Okay, so can we help it in the office? 100% yes. There's rare cases where these actually go to surgery or need some sort of injection, but these can definitely be treated with good chiropractic care, focused at muscle balance and making sure all our joints are moving properly. Okay, so we can always do kind of the what I call band-aid treatments, where it helps get rid of the pain with the anti-inflammatories, icing it, and then even a choke heart brace. So that just works at acting kind of a fulcrum, which blocks that pulling of the patellar tendon due to the tight quads. Okay, so all those things are really good at helping levels of pain, and especially if you've gone through it, you know what those kiddos are going through. What we're trying to get forward with treatment though is to decrease that tension in the quad muscle so it doesn't pull as hard. So how do you do that? So we can give really good stretches for the quad muscles, but 9 times out of 10, it's actually due to hip instability or lack of glute function. Okay, so we can activate or do different exercises in the office that we can turn on those glute muscles to help share the tension or take some of the tension away from that quad. It's no different if you had tight hamstrings, okay? More times than not, it's not the tightness in the hamstring that's the problem, it's the lack of stability in the hip, so those hamstrings act tight to prevent injurious motion. So with these kids, we're gonna give them really good exercises at stretching the quad and then activating those glute muscles so we can share the balance around. So like I said, if you know anyone who's had it, if you have a kid that's going through it, get them in here because we can definitely help with different exercises, other Band-Aid like treatments, and then laser also works really well. Okay, so don't let them be sidelined. We can definitely get them back in the game, get them functioning better, and get this feeling better so they're not battling through it with their teenage years. And like I said, it only is really in adolescence. You may see some of that raised bump area as you get older, but nothing to worry about. It's not going to become a long-term problem. It's really just as those growth plates are starting to close when we start to see it. So get your kids in here if they have that. We'd love to help them. Have a great rest of your Wednesday. See you, everyone.